Hi, my name is Kara Steele, and I'm in the class of 2021. I'm majoring in neuroscience and pursuing a certificate in the Global Health program. This summer, I had the opportunity to intern with the U.S. Peace Corps Office of Global Health and HIV. As an introduction, I'd like to say that the U.S. Peace Corps is a U.S. agency with volunteers in over 60 countries working in the health, education, agriculture, community economic development, environment, and youth and development sectors. And I also want to provide some background that the DREAMS program that I will refer to, which stands for Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe, is a public-private partnership that aims to reduce HIV risk in adolescent girls and young women. So I was interested in interning with the U.S. Peace Corps Office of Global Health and HIV because I really wanted to gain more exposure to the field of global health and develop qualitative research skills, and it ended up being a great place to do so. The Office of Global Health and HIV oversees, develops, and evaluates Peace Corps programs relating to health and HIV. So aside from regular engagement in office meetings and community of practice calls relating to the HIV and maternal and child health programming, my main contributions came in the form of reviewing Peace Corps indicators in order to help the office improve the tracking tool that volunteers use to report on the activities that they have conducted and kind of report on who's benefiting from these activities and whatnot. And then I also helped to design some surveys to get an idea of how the curriculum that is being used is being, how well it's being learned by the students and the beneficiaries of those more teaching-based activities. And then finally, my independent project that I worked on that I will present some results of today had to do, or it was a qualitative analysis of volunteer activity reports under a subset of the Peace Corps indicators, because I was hoping to better understand the role that Peace Corps volunteers are playing in activities that are similar to what the activities under the DREAMS program. So what you can see, the first graphic here is a breakdown of the content areas that I found within these activities. So you see health promotion, education, economic, and other. The pie chart to the right, titled activity type, it shows a breakdown of the types of activities that were listed by the volunteers under the health indicators. And as you can see here, clubs, recurring lessons, and trainings were the most frequently used mode to present or to have the activities in. The next plot shows the content breakdown. And so you can see primarily the activities under the health indicators I looked at were relating to health promotion with some overlap with economic and educational content. To further break down that big blue circle of health promotion activities, I show the breakdown in the following bar chart. As you can see, HIV and sexual and reproductive health are the topics that are covered most under these activities relating to health promotion. So through this analysis, as I said before, I looked at the activity reports that Peace Corps volunteers recorded under a subset of the Peace Corps indicators, and I coded them based on their content, the beneficiaries, as well as the curriculum used, and general alignment with the DREAMS framework. So to reiterate, the activities reported under these indicators were generally clubs, trainings, or recurring lessons, which means the volunteers were having repeated contact with the beneficiaries. The topics of these activities were primarily related to health promotion, and specifically HIV and sexual and reproductive health. I also found that generally the beneficiaries of these activities were youth. So, because the DREAMS program focuses on HIV risk reduction in adolescent girls and young women and aims to have recurring contacts with beneficiaries, this analysis shows that Peace Corps volunteers are involved in activities that align very well with the DREAMS program framework. This analysis will be used by the Office of Global Health and HIV as they continue to work with the in-country post teams in developing the DREAMS program in countries and outlining the role that Peace Corps volunteers can have in improving DREAMS programming within these countries. Through this project and other tasks I worked on during my internship, I now feel much more comfortable with qualitative analysis, as well as I also feel much more comfortable working with teams in an office setting. Looking ahead, this internship definitely solidified my interest in continuing on to work or pursue further studies in the field of public health. You can see on the poster a few questions that I had that I would be interested in exploring further after this internship. And finally, I feel that I have a much better understanding of how the Peace Corps, along with other government agencies, function. And I also feel like I have a much better understanding of what work in the field of global health looks like, and I'm very thankful for that. I want to give a special thank you to the U.S. Peace Corps Office of Global Health and my supervisors, Shelley and Peggy, and also to the Center for Health and Wellbeing and to the Princeton Global Health and Health Policy Internship Program for funding the internship. Thank you so much.